U.S. Surgeon General and Vice Admiral Jerome Adams joins us now. He's a member of the White House Coronavirus Task Force. Dr. Adams, it's really good to see you. Let's start where David left off with the schools. There's backlash in Florida, and you're a doctor, of course, you're also a father. What needs to happen for schools to reopen safely? And I realize different states have different needs, but generally speaking, what needs to be done for the schools to be okay for kids to go back this August, this September?
Well, good morning, Gail, and thank you for that question. As you mentioned, I have a 16, a 14, and a 10-year-old, so this is very personal to me. And what I want people to know is the biggest determinant of whether or not we can go back to school actually has little to nothing to do with the actual schools. It's your background transmission rate. And it's why we've told people constantly that if we want to get back to school, to worship, to regular life, folks need to wear face coverings. Folks need to practice social distancing. Those public health measures are actually what's going to lower the transmission rate. And we've seen in Norway, we've seen in Denmark, that when they start with a low background transmission rate, they were able to safely reopen schools with minimal to no transmission among young people, particularly people under the age of 10 or 12. Now, CDC has recommendations
what do you
about safe school.
What do you say, though, Doctor? Yeah, go ahead, go ahead.
No, I said CDC has recommendations for things that you can do in schools, but again, the most important thing is what we do outside of schools before we reopen to lower the transmission rate. The government has a role, but I want people to understand we as individuals have a role too to do what we can, and that includes wearing face coverings.
Okay, but you still got teachers, you still got parents that say wearing face coverings. Do you think that's really it? If your kids go back to school and they have face coverings, you think that's safe enough?
Oh, no, Gail, that's part of the equation when you're in school. What I'm saying is we need to be doing that now before schools open so that we can lower the transmission rate in schools. We also have to protect the older people, the teachers, the family members that these students may live with, because we know that the risk is low to the actual students, but we know that they can transmit to others. And so I don't want to in any way, shape, or form either diminish the potential impact to teachers, and we need to take measures to make sure we can protect those who are vulnerable either because they're older or they have chronic medical conditions.
Let's talk about testing, because we still seem to have issues with the testing, and now it appears the White House doesn't want to support extra funding for testing. What's the thinking behind that?
Well, what I can tell you from our deliberations on the task force are that in the last bill, there was $10 billion with a B dollars allocated for testing, and only about $36 million with an M has been drawn down from that fund. So some of the debate is not about whether or not we need more testing or need more of that in communities, but it's really about whether or not we've even spent the money that's already been allocated. I think we all agree, particularly the physicians on the task force, that we need to have more testing, more contact tracing, more isolation. But again, we also have to have a lower community prevalence rate. And I hate to keep harping, but the American people, I need you to hear me. Testing, isolation, and contact tracing doesn't work when you've got out of control spread in communities. And so we need to understand that the way we get all of this to function is by getting people to commit to wearing face coverings, to not getting in crowded gatherings, to maintaining 6 feet of social distance. That lowers the prevalence, and everything else starts to function.
Do you think the president is finally on board about wearing a mask? He seems to be changing his messaging on that.
Well, I'm a physician, not a political pundit, and it doesn't do me any good to get back and forth about the president. What I can tell you is I'm very pleased that he actually is now wearing a face covering. Medically, he's tested more than anyone. So from a medical standpoint, I understand why he chooses not to. But I'm glad that he has said that this is a patriotic thing to do. This supports your freedom. It's something I've been saying for 4 months now.
Right. All right, and the task force briefings are going to resume today. Will you, Dr. Fauci, and Dr. Birx be in attendance?
Well, they're still figuring that out. I know that as they resume, we will be there in our different roles. As folks know, I'm a strong advocate for making sure we are promoting the awareness of the impact on communities of color, particularly African Americans and particularly Hispanics.
All right, so maybe we'll see you later this afternoon at the briefing. Thank you very much, Dr. Adams, for your time this morning.
Thank you, Gail.